Well, with us right now is Dr. Brian Kim. Always a pleasure to see you.
Hey, Ken. Thanks so much for having me back.
We are going to talk about something that can be very serious, retinal vascular occlusions. Did I pronounce that right?
That's right, that's right.
And this is, as you were saying, it's related or can be related to diabetes, right?
That's correct. November is, again, Diabetes Month, and this is this kind of thing that I've come on your show and we've talked about before, diabetes and the importance of diabetes and the effects of it on the eye. And I thought I'd switch it up a little bit and give you a little bit more variety as far as what diabetes can actually do.
Right.
And we've talked about diabetic retinopathy, but it also can do other things inside the eye, such as strokes. And this is, and I use that term a little bit loosely here. It's in quotes, and I'll explain that in a minute. But,
okay.
But there are, to break it down simply, there are three types of vascular occlusions. And when we say occlusions, we don't necessarily mean total blockage. It can be partial. And it can be of any size vessel too, big to small. So diabetes, as we talked about before, is really a problem. It's a problem of sugars, but it's really a problem of blood vessels with sharp crystals, sugar crystals flowing through the veins and blood vessels and causing microscopic damage. And that's what we call microvascular occlusions. Okay. And that kind of leads to patchy loss of vision, almost like Swiss cheese vision, if you will. And that's the kind of thing that we've talked about before. But I want to talk more about what that can do on the larger scale today.
Okay.
So yeah, so artery occlusions and vein occlusions. So.
And what I'm looking here is, would you put kinked hose?
That's right. Yeah. Well, starting with the artery occlusion is really like a true stroke in the eye. The eye is an extension of the brain, and so if you have a blockage of all the blood flow from a cholesterol plaque or something, a blood clot or something, then it can be very devastating in the eye, as well as the brain. The vein occlusion is more of the return flow of the blood from the eye. So, and that is more like a kinked hose, meaning it will restrict blood flow, but not necessarily occlude it completely.
Okay.
So there are variations of degrees of severity.
Would that mean pressure would build up in the eye?
Not necessarily, but within the blood vessels themselves, yes. Okay. Yes.
And in the next slide, you show severe diabetic retinopathy, right?
That's correct. Yeah, these are somewhat familiar photographs, and it's maybe hard to see the small bleeds and microscopic bleeds that are going on in the retina on the left side on the left image. In the right one is an angiogram, and you can see all that area down below where that's lighting up. That's all patchy areas of dead retina. So that's what we call microvascular ischemia. So, and that's what diabetic retinopathy looks like.
Okay. The next one, you have what you're talking about before, the artery occlusion.
So this is much more serious, and this is something that a lot of people will come in and they'll say, you know what, I just woke up and I can't see anything. It's very scary, and it can lead to, it's all just black in a portion or all of the vision. And what we see here on this photograph is actually it's a cholesterol plaque. It's a rather large one, and it's basically lodged itself within the artery, and it can be pretty difficult to fix that, much like a stroke in the brain.
Now, being that this is cholesterol plaque, would this be in relation to diabetes, or just it can't?
That's right. Okay. That's exactly right. So any of the cardiovascular risk factors that we all are familiar with, so diabetes, high blood pressure, high cholesterol, and then there's the certain other lesser or less common conditions. Okay. So, but yeah, those are the big three.
All right. Moving on, we're going to look at a couple more slides here about the vein occlusions, right?
So vein occlusions are very common. This is probably the second most common thing that we see in this area, in this community, behind macular degeneration. And this comes from atherosclerosis, or hardening of the arteries. Sounds strange, arteries and veins, but when the arteries get hardened, they can actually push and compress on the vein themselves, creating a kinked hose situation, and that's what this arrow is pointing to. Is actually the kinked area, and that causes some congestion and backflow problems, and thus vision impairment.
So in this, they may not have total black vision, but they might have spots or something?
That's correct, yeah. It can be a patch, and it can be black, but it's often, more times than not, gray. A
Okay.
dark gray, yeah.
That would stick with you. That's not going to
can
be.
stick with you, yeah.
Okay.
So.
And in the next one, we're also going to see neovascularization, right?
That's correct, and it may be a little bit small to see on the screen, but yeah, this is a patient of mine who's had a pretty severe retinal vein occlusion. It's old, but this is the most severe case, and this is really what this is probably the most common question I get is well, if I've had a stroke in the eye and you can't fix it or replace my vision, why do we have to keep coming back? Why do I have to keep seeing you? And this is why. Because it's when the retina doesn't get enough blood, it oftentimes will say, you know what, I need more blood. Make new blood vessels. So they grow and they build up and they build new blood vessels, but they're not very good and they're not healthy and they cause problems and they bleed and they can cause glaucoma, loss of vision, and even in the most severe cases, loss of the eye itself.
Wow.
So this is a very serious complication of this, and that's what we're looking for.
All right, let's, you and I have talked about the prevention, and it's the usual things that we've talked about that go with preventing diabetes and all that. But let's go back to if they do have some of these symptoms here, what can be done? Is there anything that can be done to reverse it and get your sight back?
Sure. A lot of it depends on the time. The artery occlusions are really like strokes. And if we catch it early enough, and we can sometimes dislodge that cholesterol plaque or blood clot, that's pretty uncommon. But if we can sometimes restore vision. That's a very difficult one to do. It's much like a brain stroke. When the damage has been done, unfortunately, it's difficult to fix. Vein occlusions have a little bit more time and a little bit more leeway. That tends to be a little bit more of a slower onset, meaning for most people it's a few days to a few weeks rather than suddenly waking up one morning. Depending on how early we catch it and how much vision is affected, sometimes we can reverse some of that. Sometimes all of it, but most of the time it's most of it.
Okay.
So.
Now, what you guys can see sometimes quicker than a primary care doctor, and again, you've talked about this before, is that blood pressure. When you get your eye exams, you can actually detect that quicker than maybe someone else can. Am I right?
Sure, you're absolutely right. And long-standing hypertension and high blood pressure, high cholesterol, we can see that in the blood vessels directly. So the direct effects on the body are visible in the retina.
So you can catch it even earlier sometimes.
Sometimes, yeah.
And of course, the prevention here is the usual things.
Exactly right.
Which you would how we say, prevent high cholesterol, prevent diabetes, and a lot of it is preventable. Yes, some is hereditary, but...
Yeah, you're absolutely right.
Now, as far as somebody who maybe has already been diagnosed with the diabetes, what can they do? And maybe their sight is okay right now. What can they do? Are there certain kind of medications that they can take that are going to help?
Sure. The most important thing for diabetes is really sugar control, blood pressure control, cholesterol control. Those are the big three that are really responsible for decreasing mortality risk. But secondly, in the eyes, that's actually going to be your long-term prognosis. And to put it quite bluntly, I tell all of my patients this, all my diabetic patients this, the diabetics who really keep their vision are the ones who keep their appointments, because we don't have symptoms in diabetes until it's too late. Right. So yeah, and oftentimes we can really treat that way ahead of time and prevent any sort of vision loss. Okay, and being that there's really a couple types of diabetes, but I always forget which one is which. But one of them can be hereditary, right? That's the one that you can almost be born with or something. Even though you may have the best diet in the world, you exercise all the time, that I don't know if it's type 1 or type 2, but there's one that you may know that kind of runs in your family. That's right, yeah. Type 2 tends to run in families. Type 1 tends to be a little bit more sporadic, but that's the more severe one. Okay. So, yeah, and the typical juvenile, that's the traditional juvenile onset diabetes. Not so true anymore, but yes, that's, both very difficult. All right, so the key is get your eye exams, right? That's right. Get them checked, and once a year? It depends on age? Depends on age, depends on risk factors, but in general, we say at least once a year. Okay. Yeah. Very good. Always good to see you. Nice to see you too. Thanks so much. Really appreciate it. And we will be right back.